Hi, this is Dr. Asha Dinesh, psychologist. On account of World Mental Health Day, I wish to talk about mental well-being of ourselves and that of people around us. It can be within our own immediate family, it can be in the workplace, it can be in the educational institutions that we study, say for example, school or college. What baby step or what small responsibility can each one of us take to enhance the mental well-being within our own immediate surroundings? Well, we come across challenges, disappointments, stress in our day-to-day life. This day-to-day stress accumulates the way pressure cooker accumulates the steam, and when not expressed in a conducive way, it explodes or it manifests in the form of anger, irritation. It can be in the form of anxiety or depression, generalized pain. So here, unexpressed emotions show itself in a very, very unhealthy way. And moreover, people feel very comfortable when it comes to physical pain. When it comes to physical discomfort, people are very vocal, people are very open. But when it comes to emotional hurts, when it comes to emotional pain, people are not comfortable. That can be mainly because of fear of being judged or fear of being criticized. It can also be because our culture does not encourage expression of feelings. Our culture, moreover, right from small age, we are taught to suppress our feeling as a coping of emotions, as a coping mechanism. We have seen in culture which allow free expression of feelings, say for example in villages, we see that people, when they meet any loss or a death of a loved one, they cry out, they talk out, and they are able to deal with emotions, they are able to cope with emotions in a much, much better way. So the first and foremost here is to understand that it is very important to understand that it is alright, it is fine to express your own feelings. It is very much okay to own your feelings and to express your feeling. Expression of feeling does not mean that you are weak or you are incompetent. It is okay to say that I am feeling sad or I am feeling angry or I am feeling depressed or I am feeling suicidal. Expression of feelings by itself has lot of therapeutic and healing effect both for mind and for body. In fact, the first step in any mental health treatment is allow the person to express himself thoroughly. That leads to lot of inner cleansing. And when you find someone around you, say looking sad or stressed, it is very helpful when you give a door opener. That motivates the person to talk about his feeling, whatever is bothering him. Listening to their feelings have lot of therapeutic purpose. As I said, it is very, very useful when you listen, when you give them the atmosphere of trust and confidence, rather than overreacting or rather than giving advice or telling them what to do, what not to do. Most of the time we have seen, helping them express themselves by itself is very, very it gives lot of, that is in itself sufficient. It gives lot of clarity, it allows the person to deal with the situation with confidence by himself. So talking out leads to lot of therapeutic value. If someone around you, say for example, seems to have given up or seems to be talking about suicide or dying, take them seriously. It is also okay, it is very much okay to ask if the person is feeling suicidal. Don't fear asking if the person is feeling suicidal. That does not mean that you are going to inject the ideas. It only means that if the person is feeling so, he will talk about it, and when those ideas appear on surface, he can really be helped. As a mental health professional, we come across people, it is common to come across people, say for example a person who says that he had given up on life and he was contemplating on ending his life, and he has even planned the way he is going to commit suicide, and was on the verge of kind of executing the act, and just then somebody walks in, somebody talks to him, or some phone call, and that kind of an outlet, led to a big change where he decides to give up the idea of suicide and seek professional help. So that is the value of ventilation of feelings. In some cases, where preparing and motivating this person to seek professional help is mandatory, it is essential. Seeking professional help again is only one part of the entire picture, very crucial, of course, part of the entire picture. A lot has to do with continued emotional support from people around, from the surrounding. Thank you.